Techniques and procedures. Sperm banking and storage. Sperm banking and storage are essential parts of fertility preservation for men who wish to preserve their sperm for future use. Sperm banking allows individuals to store sperm for later use, especially when they are at risk of losing fertility due to medical treatments, age, or other personal circumstances. This procedure is widely used by men undergoing chemotherapy, radiation, surgery, or other fertility-threatening conditions, as well as by those who wish to delay parenthood. 1. What is sperm banking? Sperm banking, also known as sperm cryopreservation, is the process of collecting and freezing sperm for later use. The collected sperm is stored in liquid nitrogen at extremely low temperatures, where it remains viable for years or even decades. The stored sperm can then be thawed and used in assisted reproductive technologies, ART, such as in vitro fertilization, AVF, or intracytoplasmic sperm injection, ICSI. 2. Indications for sperm banking. Sperm banking is commonly recommended for individuals in the following situations. A. Medical conditions. Cancer treatments. Men undergoing treatments like chemotherapy or radiation may experience temporary or permanent infertility. Sperm banking allows them to preserve their fertility before undergoing such treatments. Gonadotoxic treatments. Other medical treatments such as hormonal therapies for conditions like autoimmune diseases or endometriosis may reduce sperm production. Banking sperm before starting such treatments is advised. Surgical interventions. Men undergoing surgeries that affect the reproductive organs, e.g., prostate surgery, testicular surgery, may also consider sperm banking to preserve fertility. Genetic disorders. In some cases, men with genetic conditions that might affect fertility later in life may use sperm banking to preserve healthy sperm. B. Delayed parenthood. Men who wish to delay fatherhood for personal or career reasons may opt for sperm banking, ensuring that viable sperm is available when they are ready to have children, especially if they are concerned about age-related fertility decline. C. High-risk occupations. Some men in high-risk professions, e.g., military, hazardous work environments, or jobs with exposure to chemicals, may choose to store sperm as a precautionary measure in case of future infertility due to accidents or environmental exposure. 3. The sperm banking process. A. Initial consultation and screening. Pre-sperm banking consultation is essential to discuss the individual's medical history, lifestyle factors, and reasons for sperm banking. Screening tests are usually performed to ensure that the sperm collected is free from infections such as HIV, hepatitis, and STDs. This is to safeguard both the donor and the future recipient. B. Sperm collection. Collection method. Sperm is typically collected through masturbation in a sterile container in a private room at the sperm bank or clinic. For men who cannot produce sperm through masturbation due to conditions like spinal cord injuries or low libido, sperm may be collected through testicular aspiration, electroejaculation, or microsurgical sperm extraction. Abstinence period. Men are usually advised to abstain from ejaculation for 2 to 3 days before collection to ensure an optimal sperm sample. C. Sperm processing and freezing. Sperm analysis. After collection, the sperm is analyzed for concentration, motility, morphology, and overall quality. This is crucial to ensure that the sperm is of sufficient quality for freezing and future use. Sperm dilution and cryoprotectant. The sperm is mixed with a cryoprotectant, which is a substance that helps protect the sperm from damage during the freezing process. This prevents the formation of ice crystals that can rupture the sperm cell membrane. Freezing process. Vitrification. The sperm is frozen using a method known as vitrification, which is a rapid freezing technique that prevents the formation of ice crystals. The sperm is then stored in liquid nitrogen at temperatures of minus 196 degrees Celsius. D. Sperm storage and storage duration. After freezing, sperm is stored in liquid nitrogen tanks at the sperm bank or fertility clinic. Long-term storage can last for many years, and sperm remains viable as long as it is stored at the appropriate temperatures. Sperm banks may allow clients to store sperm for indefinite periods with regular checks of the storage conditions. 4. Using frozen sperm. Frozen sperm can be used for a variety of assisted reproductive technologies, ART, when the individual is ready to have a child. In vitro fertilization, IVF. The sperm is stored and a sample is used to fertilize an egg in a laboratory setting. The resulting embryo is then transferred to the female partner's uterus. Intracytoplasmic sperm injection, ICSI. In cases of male infertility, particularly when sperm motility or concentration is low, a single sperm is injected directly into an egg to achieve fertilization. The embryo is then transferred to the woman's uterus. Artificial insemination, AI. In cases where sperm quality is normal, sperm may be thawed and used for intrauterine insemination, IUI, where the sperm is directly placed into the uterus. 5. Advantages of sperm banking. A. Fertility preservation. Provides a means for men to preserve fertility before undergoing treatments that might compromise sperm production, e.g., chemotherapy, radiation. B. Delayed fatherhood. Sperm banking offers men the ability to have children later in life when they are ready, without the concern of reduced fertility as they age. C. Emergency backup. For men with health conditions or those in high-risk occupations, sperm banking provides a safeguard in case fertility is compromised in the future. 6. Limitations and considerations of sperm banking. A. Sperm quality and viability. The success of sperm banking is dependent on the quality of the sperm collected. Sperm from older men or those with low sperm counts may not be as viable after freezing. B. Cost of sperm banking. The cost of sperm collection, freezing, and storage can be expensive. Some sperm banks charge annual fees for storage, which may be prohibitive for some individuals. See legal and ethical issues. Sperm banking can raise legal and ethical issues regarding ownership and the use of sperm in the event of the donor's death or divorce. Some men may also face ethical concerns about using sperm after long storage periods. 7. Conclusion. Sperm banking and storage offer a valuable opportunity for men to preserve their fertility for future use, whether due to medical treatments, delayed fatherhood, or high-risk occupations. Sperm banking ensures that viable sperm is available when needed. While there are advantages such as fertility preservation and flexibility in family planning, There are also challenges and considerations, including sperm quality, cost, and ethical concerns. This technique continues to provide men with more options in reproductive planning, contributing to greater control over their reproductive health.